Welcome back to the Miller Center. It's great to see everyone. Today we have a terrific webinar on jobs. Flattening the COVID curve has led to a dramatic spike in a different curve, which we're all aware of, unemployment. In the US, at least 22 million people are now out of work across all sectors of the economy, even healthcare. The $2 trillion CARES Act, perhaps the greatest emergency action ever, rivaling FDR's New Deal, includes direct payment to businesses and workers, increased availability of paid leave and unemployment, expansion of unemployment insurance, and student loan aid, just to name a few pieces. And then we need to restart work and provide security for workers whenever the COVID curve flattens. As President Trump has acknowledged yesterday, governors, state, local, and firm level leaders must make some choices, including hard choices. Of course, a few in-person businesses are not just hard at work, like us at the Miller Center, but experiencing both shortages and greater needs. Workers on the front lines include health workers, transport workers, workers in supermarkets and related services. Others are getting by, and perhaps a few are even thriving by remote work, which has its own long-term questions about how work might change in a post-COVID world, including everything from how we structure our offices and homes to whether, when, and how we travel. And then, for instance, there are schools. With apologies to my two wonderful daughters, after a month home with our kids, we all want to send our kids back to school. While their risk of dying from COVID is not high, the risk of their spreading the disease, however, to more vulnerable teachers, administrators, coaches, cafeteria workers, janitors, not to mention back to their parents and grandparents, is high. So the reality is there's no crystal ball. No one has the ability to fully predict what is coming and when. This is perhaps the biggest challenge facing our economy at the present, as businesses are not able to forecast what the next few months or even years will look like. To help us understand and work through those questions, we have two leading experts with us who we're delighted to have today, Leora Friedberg and Chris Liu. Leora is an associate professor of economics and public policy at the University of Virginia, both in the College of Arts and Sciences and in the Batten School. She's an expert in public and labor economics, particularly with a focus on savings, retirement, pension, and benefits. She's also the co-chair of the Retirement Income Institute. She has affiliations with Michigan's Retirement and Disability Research Center, the TIAA Institute, and the University and the Virginia Center on Tax Law. She has advised on employment and retirement issues for UVA, the federal government, and leading academic journals, has testified before Congress, received major grants from federal research agencies on labor, aging, and retirement issues. And speaking of work in schools, her son and my daughter have been co-workers at a certain local gelato shop on the downtown mall. So Leora, welcome, and Annika says hi to you and Louis. Chris Liu is the Teresa Sullivan Practitioner and Senior Fellow at the Miller Center. Chris has served in all three branches of government. He spent 7 years in the Obama administration as Secretary for Cabinet Affairs, which is the principal liaison to the federal agencies, and then later as Deputy Secretary of Labor. He also was executive director of the Obama transition in 2008 in the middle of a financial crisis. He's 2008, 2009. He brings a unique knowledge of the inner workings of presidential administrations and a solid understanding of how agencies run and work together to produce effective results for the American people. He also worked for then Senator Obama, and before that on the House side. So he also has a deep knowledge of Congress and how to effectively work with lawmakers, which is particularly important as additional pieces of legislation move through Congress. He draws on his extensive political experience as a regular television and radio commentator and brings years of regulatory, legislative, and political experience to his current work. And that work is, in addition to his involvement here at the Miller Center, he's a senior strategy advisor at Fiscal Note, a DC-based technology company, and a government relations management platform, and is a board member on the American Sustainable Business Council and the AAPI Progressive Action. So thanks to you both for joining us today, and as always to our technical team and to you, our audience. Please send your Q's and A's in. There is a toggle on the bottom of your screen if you've joined us in the webinar format. And if you start sending questions, I'll do my best to field and coordinate them for our two great guests. So let me start with a question. What's going on? You know, we have this certainly spike in COVID cases that is still rising, potentially flattening. It's certainly flattened in a few places, but is rising in other. And then we have this other rising spike of unemployment. Where are we? We've all been watching these charts. What are you watching, and where do you think this is going to go?
Well, what I see is that in Virginia, we've done a good job at flattening the curve, and yet the latest modeling from the UVA Biocomplexity Institute was actually sobering because now they're predicting a peak infection rate in August in Virginia. And so the time horizon just keeps getting longer and longer, and that really, I think, underlines the importance of testing and tracking, because I can talk about this more at length, but testing and tracking is going to help us deal with both curves.
Well, from a labor perspective, you know, we're seeing numbers we have never seen before. Just to give you two in particular, the number of jobs created, again, we'll highlight this more. These are all lagging indicators, so this is historical data. But in the month of March, the U.S. economy lost 700,000 jobs. At the height of the Great Recession, we lost 800,000 jobs, and I suspect when the April numbers come out, there will be well over 1 million jobs have been lost. Potentially several million jobs have been lost. The other number that continues to jump out is every Thursday.
Just in those months alone.
Yeah.
Right.
Every Thursday, we get the numbers of people who have filed for unemployment claims in the week before. The highest month ever during the Great Recession was, I think, about 600,000. The highest historically ever was during the 1982 recession under President Reagan at 680,000. Yesterday's numbers were 5.2 million people filing for unemployment insurance, and that was actually a drop from the last couple of weeks. All told, in the last 4 weeks, 22 million people have applied for unemployment insurance. It's about 1/10 of the labor market right now. And so these are numbers we've never seen before. You know, and when the final unemployment numbers come out in a couple of weeks, we could easily be seeing an unemployment rate 15–20%. Again, the peak during the Great Recession was about 10%.
Let me ask you both, since Chris, both you and Leora have spent a lot of time with data. One of the big things that the Labor Department does is, although it's done in an independent agency within the Labor Department, compile and announce these unemployment statistics. What do we know from the data? How reliable is it? Where does it come from? How and what are we tracking in the data?
I think data weaknesses in our data infrastructure have really come to the fore, and so the conventional numbers of, you know, unemployment claims each week, even those we're not sure, because the state systems for filing unemployment claims are so overwhelmed, and many of them are using the computer language COBOL, which was a big deal in the 1960s. And so, you know,
I remember COBOL.
Yeah, well, so interestingly, the Social Security Administration still uses it as their main language. But that goes to show how behind some of our data infrastructure is, and then just our knowledge to be able to say who actually needs relief at this point. You can see it in the way that the unemployment insurance bonus of $600 was jerry-rigged, because they couldn't do a percentage, they couldn't do anything related to percent of lost earnings, because the state unemployment systems couldn't handle that. The tax rebate has also been jerry-rigged to some extent. It's based for some people on 2018 returns, for some people on 2019 returns. None of that tells us who needs it now. And people who had high income those years and have lost their jobs now may not get relief until next year even. And some people are in the opposite situation. And we've read more about the problems of being able to track travelers and track, if we really want to do public health surveillance, but just seeing how much difficulty we're having with economic relief is really sobering in terms of understanding how everything should be targeted. It's been really limiting.
Mm-hmm.
You know, Leora's point's an important one. You know, when we look at unemployment insurance data, we have to take note that the system is basically run by all 50 states and territories. And so these are not systems that were ever meant for the amount of people applying online as has been. And, you know, in addition to the systems not being easy to navigate, there are actually new rules on who can apply for unemployment insurance. The CARES Act, the one that recently passed, provides assistance to gig workers and part-time workers, which were generally a category of workers that had not been counted before in unemployment insurance. And so I think there's a lot of reason to think the data is accurate, but it probably understates the problem. The other challenge we have is trying to figure out which sectors have been most affected. And we anecdotally know that leisure and hospitality, so restaurants and hotels, were in that first wave of industries that were affected. We now know that retail, we've got some retail numbers from the other day that were the worst that had ever been collected. Those were bad. We know that manufacturing is now being affected. I think the next wave that you'll see, even if the data doesn't necessarily show it, is kind of white collar, salaried office workers. And it's not just the people who are working in the big companies that are having furloughs and layoffs. It's going to be lawyers, it's accountants, it's dental hygienists. And so the longer this goes on, I think the longer you'll kind of see these ripple effects affect other industries.
And how much are the relief efforts affected by the data challenges? In other words, Chris, to the point that you just made about a new wave of white collar people being affected, as Congress is considering a potential successor to CARES Act, or maybe CARES 3, CARES 4, they're thinking about successive waves. How well have the previous ones been targeted, and how quickly can they catch up with these emerging second and third waves of affected employees?
Yeah, and so we haven't even, I mean, we've just been talking about the worker perspective. We haven't even talked about the small business perspective. There's in the CARES Act a $350 billion tranche of money that goes out to small businesses to encourage them to, or require them actually, to keep people on payroll, and the loans then become a grant. We now know that the total amount of money is being accounted for in loans, but I don't think we have a great sense of what type of small businesses have been affected by that. A small business actually in this country technically goes up to 500 employees, which is more than I think what most people think. So the question is a 500-person business getting that money, or is it the mom and pop bodega in New York City or your neighborhood dry cleaner? We don't know any of that yet. And so we want to make sure that the money, obviously as policymakers, need to ensure the money goes to those industries most affected. On the worker front, the challenge is also, again, and this is not meant to minimize anybody's unemployment status, but if you start to have higher wage employees losing their jobs and filing for unemployment insurance, whatever plus up was given in the CARES Act, the $600, will not even come close to enough to helping them cover rent, mortgage, and things like that. And we don't really even know within this demographically what ages of people we're seeing, which could have impacts as well.
Leora, as you track the data coming out and as it's unrolling, and you're watching where aid and assistance going, what is coming forward? What are you looking for, and how are you trying to match the two?
Yeah, the small business program is a good example of the lack of information and targeting, because it seemed like the businesses that got the money depended on which banks were able to process loans, and whether and the paperwork was complicated, and so some people had lawyers helping them and some didn't, and so there was no way in which the money was allocated to those most in need. It was on a first come first served basis, and so that it's hard to see how that's going to help match the dollars to the need. And so I think, Chris is right that as we move forward, we have to have a better sense of where the need continues to arise and which sectors are being affected and which types of workers.
One of our viewers has asked, nobody's asking us to predict the future, but if you had to guess how many of these new jobless claims present jobs that have been permanently lost versus temporarily paused, what would you say? Do you have any sense of, what comes back either slowly or quickly once the curves have settled, once we get past the combination of testing, vaccine, tracing, all of those things?
Economists are really debating now what that recovery will look like. And some people say, would it be like a V where we recover everything at the same speed that we're losing it, or more like a U where it kind of recovers a little slowly? And some people are talking about an L, just to keep it in the alphabet, where it stays low for a long time. And this is obviously a big unknown. I think one interesting thing that'll make it different from past recessions is that young workers may have a lot more opportunities, being less susceptible to the disease. And in past recessions, young workers are particularly scarred or delayed in starting their careers. And this might be quite the opposite, which would be really interesting and encouraging in some ways. I think I have a personal theory that another big difference from past recessions is that in past recessions, people start to limit spending gradually in order to kind of smooth out the harm to themselves and then recover gradually. Here we're dropping consumption and spending so much, and we're all just sitting at home bored and not doing anything. I think in some types of spending could actually have a big rebound effect once we're allowed to go out and spend again. So that's something, something potentially heartening, but also would make it more difficult to project based on past recessions.
Well, would certainly hope that that's the case for the 75 or 80% of us that are still actually working, whose jobs have not yet gone away.
And for those who lost their jobs, it's going to depend a lot on what the relief looks like. Chris?
Yeah, no, I'd say this. I mean, the theory has been, we're flipping a light switch off on the economy, and the only way a V-shaped recovery happens is that when you flip the light switch back on, everything goes back to normal. I think it's fair to say, again, if you look at large industries, let's just say the airline industry, like, can you anticipate they'll be back at 100% capacity again by the end of the year? And the answer is probably no. Or if you think about car companies, are people going to defer purchases of cars given financial uncertainties? We forget, but 2/3 to 70% of the US economy is driven by consumer spending. So if people don't feel comfortable about their own financial situation, no matter how much they want to get out and try to help spend some money, that's necessarily going to cause more of a slowdown in the economy. I think part of it also depends on how much longer the shutdown efforts stay in place and what it looks like when we emerge from that. So a good example is restaurants. So let's say Governor Northam, since we're in Virginia, says, restaurants can reopen, but you can't have as many people as you could have had. So take whatever the fire code says you're allowed to have. You can only have half as many people in your restaurant. And an interesting question is posed, given the slim margins in restaurants, could a restaurant operate with 50% capacity? I suspect most of them could not. So I think, it is really a function of how long this goes on for and what the mentality of consumers are when they come out of this.
Mm-hmm. Let me ask one other thing before we turn to how you restart the economy. I'm really quite focused, partly because we're doing a number of these webinars, and we have one product placement next week on the healthcare system and how the healthcare system is responding in this health crisis. It's a health crisis and an employment crisis, and many people's healthcare coverage is tied to their employment. So tell me about unemployment and health insurance. Do you have any sense of how many people are claiming unemployment now who are losing their health benefits in the process, and what that might look and feel like, not just right now, but over the next set of months?
I think part of it is the difference between being furloughed temporarily and being laid off permanently. I know that a lot of companies are furloughing temporarily, but still extending health coverage for their employees. And I know certain states have also reopened their Affordable Care Act exchanges to allow people to sign up for healthcare. There was not a federal decision to reopen all of them at one time. So I think that's the challenge as well. And again, I think it sort of depends on if we're looking at maybe being closed for another month or so, that will, from a healthcare impact, have much less of a be much less detrimental than if this goes on for several more months, or if we see this happen in wave after wave throughout the rest of the year.
Yeah, I think that's a really interesting question, and it's another example of something we just don't know that much about in detail. Because so many jobs. That's where many of us get our health insurance. But I think it's in the bigger picture, it's highlighting that fragility of our safety net, and it's the kind of thing that I think could lead to bigger changes going forward. The linkage between employment and health insurance is a little crazy when you consider, that it makes people stay in jobs just to keep health insurance, and it's a pretty unique system compared to the rest of the world, and this, I think, may help break that link and lead to other alternatives, like either the marketplace or government single payer, and I think it in a way it will lead to some healthy debate, I think.
Laura, you've also touched on a bunch of other different pieces here of how the connection to work in a crisis like this affects a number of other social dimensions. Why don't you tell us a little bit more about, on the social side, the kinds of things that you're watching and paying attention to?
I think one thing on the social side is just the well-being many of us get from our jobs, and part of that comes from being in a community, and that's certainly something that many of us are missing. And connecting this way, where I see your pictures and boxes, isn't quite the same thing. I'll also mention the background behind me, which is not where I actually am. I'm in the guest bedroom in my house. The background is the place where my colleagues and I eat lunch, and my colleagues are really smart economics professors, and every day we debate economics, and we're not able to have those debates very much right now. And so a lot of what I've learned is that in-person interaction is very difficult to replace, even in this age of connectivity, and in the higher education sector, and as well as K through 12, I think we're seeing that in-person contact can't replace the importance of in-person contact for learning has not been replaced yet. Certainly the case. So those are the kinds of things that I've been keeping an eye on because my own personal, economic well-being depends on the higher education sector. So I'm very interested in how we're going to recover, and all the extra teaching we're going to have to do because of the people missing the material now at the high school level. When they get to college, what are we going to do about people who haven't finished their calculus class or their Spanish class? And those are going to be really challenging, interesting problems.
Yeah, Chris, when you think on the broader dimensions of things connected to work, I know the Labor Department tends to track those kinds of things as well. So what jumps out at you as a work-related thing that right now is not happening, and that probably, or is maybe happening as a result of unemployment, that we should be paying attention to?
Well, I think Leora is right. I mean, I don't think we can ever minimize the social aspect of work and what work means in terms of the value of somebody's existence. It is interesting. There are people that have now started thinking, well, is this kind of a preview of the new normal? A couple examples. So obviously the retail industry has struggled really since the advent of the internet. Now as more people, purchase their products on Amazon, will that just sort of be a permanent change and really be kind of the final death knell for a lot of, retail, malls, things like that. Look, doing something on Zoom is never going to replace an in-person meeting, but I think people have adjusted, and it does certainly highlight, the fact that we can have more remote employees. We don't all physically need to be somewhere. And what implications are that for office space as well? And I think it also, highlights again a lot of and we should focus more on this, and a lot of the divides that we still have in this country right now. I mean, the idea of doing distance learning makes a lot of sense if your kid has a laptop and high-speed internet. It doesn't work so well for a lot of people in this country, depending on their socioeconomic status or where they happen to live. And so it's caused us to kind of re-examine, and I think there are ways that we will adapt in a positive way after this. And I think it really highlights a lot of the inequities that we still have in our society.
Yeah, as you both said, there are parts of work that we simply can't replace. I'm sharing my favorite part of work that can't
Go
be
Who's.
Let's go on. Let's turn to how we get back to work. There have been a number of questions about everything from how you evaluate the trade-off between addressing the disease and addressing the consequences of the disease, curves about death rates dropping, and how you balance that again, restarting jobs, and how you actually get the process of restarting jobs going. So I want to start with Chris here, since you lived through a financial crisis in the past, including the response and the recovery that was overseen by Vice President Biden, who's now a presidential candidate. What are you watching in the way that President Trump and his administration are addressing these issues? And, without getting too political here, what would an alternative model look like if there was one?
Well, I think where the president settled yesterday in terms of issuing non-binding guidelines to the states and deferring to states on the decisions makes a whole lot of sense. And what is fascinating to see out of this is kind of the regional compacts that have come out of this. There's one on the West Coast, one on the East Coast, and I think increasingly you'll probably see Maryland, DC, and Virginia make their decisions jointly. I think that makes a lot of sense because we understand that pandemics don't respect borders, and in this era of driving on I-95 to get to different states and state borders not meaning anything, I think states have to act in a regional way. I think in terms of how to restart the economy, I think it'll happen in a gradual way. I do think we need to sort of take a look at, again, some of these inequities that I think will prevent the economy from flipping on immediately. The most obvious one being if schools are closed, in the absence of safe and affordable childcare, how's a worker going to go back? How's an employee going to go back to work? What are they going to do with their kids? Particularly if you start getting into this period where summer camps are closed as well. So I think we need, and if again, if we are in a world in which it's not just social distancing, it's wearing masks, it's potentially having PPEs available for more people. Do those even exist? Are there even enough right now? And what liability? Some large companies have asked for liability protection in the event that one of their employees gets sick. So I think a lot of these things are still going to have to be figured out. And so I think a gradual reopening makes a lot more sense than all at once.
Mm-hmm.
Yeah, and I think schools are certainly part of that. And what we're seeing in a few countries in Europe is that they've started to reopen the schools or especially the younger grades as part of the first thing. And maybe that's partly because the younger grades, that's where we need the childcare the most. And that maybe also we know from a lot of economic research that educational inputs at young ages are the most critical for long-term achievement. But I think with all these decisions, as at the government, at the state government level, at the employer level, at the individual level, we'll all be making these very profound trade-offs between our physical and our economic well-being, and thinking through what kind of risks individually we each all want to take. Economists are very good at pointing out that people make these calculations all the time. When you decide to get in your car is a dangerous vehicle that can kill you or can kill other people. And yet you want to get in your car to go buy things and to go enjoy life. And so And so we're making these trade-offs constantly in our daily lives. And so this is, until there's a vaccine, this is going to become another trade-off. And I think, employers may start, offering, some number of employees can come back given physical spacing needs, and the employees who most want to make that trade-off are going to be the ones who take that up, I think, and some are not going to be willing to. So I think we'll see that kind of gradual process where individuals are deciding how much they want to re-engage in the economy gradually until there's a vaccine to deal with it.
It's a great question and answer, and it raises a couple questions, and I'm torn. I feel like I've hit a fork in the road, and so Yogi Berra style, we'll do both. Let me start with schools, which is the decision about schools is obviously a critical one. I think all of us that have kids are facing it and feeling it, and those of us that work in schools are all facing it and feeling it as well. There is a question both in a health crisis and in a recession that any parent and student faces, which is whether to stay in school or opt out, right? Especially if you're thinking about another level of education that you have to pay for. Do you do that during a recession, and now with a health crisis on top of it, take the health risk on, or even not take the health risk and do it remotely, because being in school in a recession is a good thing? How do you view that? Is the investment in education at a moment like this worth taking, even if there's some risk involved?
College attendance goes up during recessions. It went up substantially, especially at the community college and public university level. So I think that's a lot. I think a lot of people are going to be thinking about, okay, well, if I don't have a job and can't be productive that way, is there some educational, some additional education I can get, some certification? From what I'm hearing, we may be thinking about the fall semester on a hybrid basis. If some students and faculty may be able to be in the classroom and some not. Some of our students internationally may not be able to travel. Some of our older faculty may not choose to expose themselves. So there may be a lot more online options available for people to take advantage of. But I think that conversely, I think some students may choose to delay. Some students who don't need to go to college yet. My son, who is a 12th grader, is thinking if he can't have the college experience he wants in the fall, he may wait a semester. And that's going to actually be a huge tuition hit for the colleges if a significant fraction of students don't show up, and yet we have many universities and colleges have many fixed costs of offering classes.
Yeah. Chris, does the Labor Department track those kinds of things too? And is that something that people think about, the trade-off between school and work?
Yeah, no, I think it's an important point, and I think we also need to understand, again, whether it's higher education or even K to 12. There are a lot of ancillary employees who aren't involved necessarily in teaching. And what does it mean if a school comes back, as Leora said, you have fixed costs, you come back with 70% of your students? Well, you don't need X number of dining hall people, you don't need X number of counselors anymore. And what happens to those people? Do those people get kind of lost in the shuffle? And it's, again, I think one of the issues why state government budgets, and again, that affects a state university like UVA, are so cash strapped right now, and how do they then adjust? And one of the things that we did in the Great Recession was provide this big infusion of money to state governments so that they wouldn't be laying off not just state government employees, but teachers and firefighters and police officers. And it's kind of the ongoing debate that's happening right now in Congress. So yeah, in a world in which we have, and again, we could have a whole broader conversation about the teaching of colleges, which essentially has not really changed in the last, several hundred years, and whether the best model of education is 150 people in a large lecture classroom. So maybe it does create greater efficiencies, but we need to understand those efficiencies have a human cost as well.
Yeah, absolutely. One last piece before pivoting to how employers can safely bring their employees back to work. But Chris, I remember even from back in the day when you were still at the Labor Department, we had a conversation with you when we were thinking through our first year project. One big question was childcare for workers. And at a moment where that's now not being provided, or in the summer, if kids are school aged, but there are summer programs that allow parents to still be at work. How does that get fleshed out in the current moment? If you can't safely provide over the summer, if Leora is right and the models are indicating that the wave actually extends through August and summer programs aren't being provided, how does that affect workers, and what impact does that have on employers that are still at work?
No, I mean, I think it raises the broader question about the social safety net. And it's one of the reasons why, if you look at countries like Scandinavia that have a much more robust, not just childcare system, but paid leave, paid sick and family leave policies, they could probably both take down their economies faster, shut them off, and then turn them back on. And I think, again, it highlights the fact that we have these underlying inequities in this country. It's something like 40 to 50% of leisure and hospitality workers prior to this did not have paid sick or family leave. And that's a problem because these people are often on the front lines of interacting with customers. And we don't want to put them in a situation where if they're sick, they have to decide, hey, I'm going to stay home and not earn money. And again, childcare is sort of the same issue. It's not just a luxury of having somebody come to your house. It's often a necessity for people. And when you have huge childcare costs that are eating up your salaries, you might make a decision that, like, it is not worth it for me to go back to work, particularly given the health risks. And so I think these inequities just need to be figured out. Fortunately, in one of the earlier relief bills that went through, there was this temporary paid sick leave, paid family leave that was put in there. But again, I think we need to have a larger conversation in our country about these programs. They're not just luxuries, they really are necessities.
Leora, I want to steer it back to you and then circle back to how we pay for all this, which is a question that I'm seeing a lot of in the Q&As. But since one of the things that you pay attention to are benefits, including retirement benefits and others, providing worker safety ends up being an additional benefit now, right? Presumably, if you're bringing people back to work, if you're a casino operator or if you operate JPJ, and it's a business based on bringing a lot of people in place and moving a lot of people in and out, the workers that are doing that have to have some sense that they're going to be safe in doing that. And I'm just curious, in the various models for big benefits like retirement and health, how much things like this are taken into account? How does that change the way employers think about businesses, including starting businesses, and where do those funds come from, particularly if there's uncertainty about the revenues that are going to be coming in looking ahead?
Well, I think this is something that's ultimately going to affect the speed of recovery, just like Chris was saying, because for workers to go back to these jobs, we're already seeing it with supermarkets that employers are going to have to raise wages to compensate for some of that risk. In economics, we talk about compensating differentials to account for the differential risk of doing some jobs compared to others. And jobs that weren't risky before are now becoming risky jobs where you deal with a lot of people. And so when employers start to have to pay more for one of their major inputs, which is labor, then they're going to raise prices. The money doesn't come from nowhere to pay those things. So I think that's another way in which there's going to be kind of a longer, slower recovery, is even as people start to get back to work, if it's not completely safe yet, then the costs of just having a reduced workforce with more PPE and so on those are real costs that we'll all have to pay for, I think, in the form of higher prices for goods. So I think that's something that potentially the government could also pay for it, but then we pay for it as taxpayers. I don't think there's something obvious the government can do to solve that problem. It's just one of the additional costs of this crisis that we're going to face.
Yeah, I think that raises a big question that we've seen
Yeah.
in a number of questions, and I could go through each of them, but let me just ask it in the biggest, baldest
How are
way
we going to
possible.
pay?
Right? How do we pay for all this? Right? Like one could imagine whether or not there are models that support it. A theory that says the government should just blow cash into the system in every way possible. Maybe have a few requirements. You have to keep certain people on. You have to provide certain safety things. But let's force the cash in now and get as many people, make that recovery shape as V as possible, like how I did that, and get people back working and take the insecurity and the uncertainty out of it for employers because the cash is there. The other is let the market determine it, but have the government take a step back. But that the risk there is that it could lead to a U shape. Am I thinking about it in the right way? And more importantly, are policymakers thinking about it in that way, or are they thinking about it differently?
I think that's right. The more the government can help us smooth out the crisis, this this is the usual debate during recessions. Whether is we do see these Keynesian features where the government can help support spending to some extent, and therefore the trough of the recession isn't as deep, and possibly the recovery is longer, but that's what that's entailed in that smoothing. I can say from a macroeconomic perspective, which I've learned from my colleagues, not because I'm not a macroeconomist, but right now the US government can borrow almost for free. Right now, Treasury rates are super low. They were already kind of low, but in March they were almost zero for short-term borrowing. They've gone slightly above zero, but they're still really low, and that's because people want safe investments right now. And the U.S. dollar is especially privileged in that regard. The U.S. dollar is viewed as a safe harbor, and U.S. government debt is viewed as safe. And so we can benefit from that by having more recessionary spending that's debt financed. In the long run, we do have to pay for it at some point. Although the extent to which the dollar stays the safe harbor means the bill doesn't quite come due as soon. And so I've already seen proposals for things like maybe a progressive income surtax that should be could be passed into law now, but would affect when, as incomes and profits start to rise again in a recovery, then that helps pay some of these costs from the current for the current moment. I've seen a revival of proposals for a wealth tax, and it could be a one-time thing to help pay these costs, or maybe that becomes a permanent thing. I think those things, from an economic perspective, economists, I believe, have not fully resolved whether a wealth tax would help or harm the economy as a whole. But I think at this moment, a one-time wealth tax, especially if it were done kind of as a surprise, I maybe shouldn't even be saying it, but if it's done as a surprise, then people can't avoid it, and then it raises a bunch of money, and then if you can commit to only doing it one time, then it's actually a pretty efficient way to help pay for all of this.
Chris, that question comes up time and again when you think about this. A, how do we pay for it? B, as John Smith asked, he hasn't been hearing any talk about inflation. Why is that? Is there any need to be concerned that all this spending will lead to even greater deficits that will then drive inflation?
It has actually been remarkable over the last 10 years of the economic expansion that inflation really hasn't been an issue at all. It is notable, before this outbreak, the federal budget deficit was $1 trillion a year. We've added conservatively about 3 trillion, and there's probably at least another trillion coming down the road. But as a policymaker, a foreign policymaker, I don't think we have a choice. And I think the lesson we learned from the Great Recession was not having enough stimulus, I think, simply extends the recession. If you go back to 2009, the most amount of money that we in the Obama administration could get passed was $800 billion. What's happened now is just dwarfed that by multiple magnitudes. But Leora is right. I mean, the goal is that you put money in now. the trough isn't as deep, and hopefully you have a bigger recovery. But it's certainly not going to create a recovery in the magnitude of 3 to 4 trillion. So money will have to come from some other source.
I'm curious to look now to the future. We've got about 15 minutes left, and Chris, we've had you in so many times to talk about the future of work. We've had one question here already saying that we already were hearing talk about AI. Will the current crisis expand that? Talk a little bit about that, and also from Maya Gayamagami, one of our council members and a physician here, asks about whether the incentives moving forward should be targeted to particular industries, manufacturing, infrastructure, renewable energy, so that as we come out of it, we're creating jobs for the economy that we want maybe, and not the one that we have. So how do you think about the future of work and who's getting employed, and what the crisis might lead to?
Yeah, I think obviously this is going to accelerate a trend that's already happening in terms of moving towards technology and industries that had not embraced them, or the use of AI. I mean, simply look at retail. I mean, if Amazon continues its upward trajectory, that means retail continues to die. Retail tends to be more labor intensive than people shopping on the internet. Or if obviously we do more distance learning, that means obviously fewer professors. It might mean fewer ancillary staff at universities. If we move towards telemedicine, again, doctors are employed, but maybe some of their support staff are not. Or even think about, one of the biggest outbreaks happening right now in the country is in South Dakota, where 240 people in a pork processing plant, because they're all kind of on very tight processing lines together, all got COVID-19. Technology could basically do the work of people. You would need then fewer people on a meat processing plant. So I think it will accelerate it, and that's certainly good because it leads to cheaper prices, more products. But from a labor perspective, that means a lot fewer people have jobs.
We've had centuries of machines replacing workers, and what that does in the long run is expand the economy, and the workers start doing different things than they did before. The big question people feel with AI is will that somehow be different, that we won't need workers anymore to do anything? And I think those are really profound questions that we don't fully have answers to. One other area of discussion I've seen of changes going forward is the idea of globalization. And will we step back from having these global production chains, which are more vulnerable perhaps than we realize to a health crisis, but also we're seeing are vulnerable to political standoffs and national security concerns and international relations, with disputes with China and so on. And so some of the articles over the last week or two have suggested that companies and countries are both thinking about where to have all their production located. And that could offset some of these, it could help offset the decline in manufacturing that's been going on in the US. And that would actually be really interesting, because that's not something economists had really anticipated at this point. We thought it would keep manufacturing jobs in the US would keep disappearing. But there may be a policy decision that some products we need to keep being able to produce to at least some extent in the US, or it may be a private sector decision that they need to have more distributed supply chains. And so that's going to be that could potentially be a change that we see as well.
Mm-hmm. Leora, you also have written and commented on the fact that during the Great Recession of the 2008-9 crisis, it changed people's view of retiring. Mm-hmm. Tell us a little bit about that, and on that same set of questions, what you were thinking about the current situation, whether the impacts would be the same or different.
Yeah, it's what we saw in the Great Recession, which was really interesting, was that older workers actually suffered less in the Great Recession than any other age group, and and older workers started to stay in jobs longer. It's really been kind of about a 20-year trend after almost the entire 20th century of people retiring earlier because they were wealthier, because Social Security came into place, employer pensions, many features led to earlier retirement for a century or more. But starting around the 1990s, we started to see people work longer, and that reflected, I think, Social Security, real Social Security benefits starting to decline, employer pension structure changing, and some of that was accelerated in the Great Recession, that we started to see workers in their 60s, late 60s, and even later stay on the job longer. It'll be really interesting to see what happens now with, as I said, the COVID-19 crisis, because the age distribution of who's affected is so steep. I think that's going to put a brake on some of those trends, because I think older people are not going to feel comfortable in the workplace, and then that temporarily creates some opportunities for young workers to step in. That has implications for Social Security. In fact, people claiming Social Security early tends to be a good thing for the trust fund because they get lower benefits. It's a good thing for the Social Security Trust Fund, but a bad thing for your benefit for your income in old age, because when you get lower benefits from claiming it at age 62 than your income at ages 85 or 90, with more than half of people surviving to those ages, elder poverty becomes a bigger deal. So I think there's going to be a whole tilt in what happens with work and at older ages and income. And so I'm going to be studying how this affects the Social Security Trust Fund going forward on the benefit side. Another thing we're seeing with the mortality, which is very concerning and really kind of tragic, again, is this socioeconomic correlation that because of comorbidities and maybe because of exposure, people at lower socioeconomic status are dying at a higher rate, and that has big implications for what well-being looks like at older ages.
Yeah, Tahi Wiggins asked that very question, Chris, and I'm sure you've been watching this carefully. Tell me your own thoughts about that. I was also quite struck, as part of the context of the question, that Amazon had moved these two new facilities, one here in the Northern Virginia area, also one in the New York area. And then you start seeing Amazon employees stepping forward and saying that they, at the younger end of the spectrum, that they weren't being protected, but also that in a lot of these places, one of the reasons that they selected those places was to have a more diverse workforce. So you're getting employees now challenging and asking about worker protection.
Yeah, I mean, look, the racial disparities have really been striking. I mean, whether it is in Chicago, Milwaukee, other places that they've looked at it, African Americans are being infected at a much higher rate. And again, I think will be important for people to study, whether it's simply because of being in closer proximity to people, given housing issues, or whether it really is a health disparity issue, and people who are have pre-existing respiratory issues, or they now believe obesity could be an issue as well, could play a greater role in all of this. I think the broader issue about what this means in terms of like existing racial inequities, I think, and just broader inequities, I think needs to be examined. My concern about where we are right now is that this has largely been seen in terms of a problem in metropolitan areas. And this is, I think, has both public health dimensions, but also economic dimensions. If and when, and we'll say when, this starts to spread to more rural areas, that's the problem. We've got a rural healthcare situation that is badly underfunded right now. And in many ways, you've got sort of not only health disparity issues among races, but certainly between rural and urban or rural and suburban areas as well, that would be magnified. So in some ways, you could see the impact of this being as stark, if not worse, if this becomes a rural outbreak as much as anything. And I think it just sort of highlights more sort of the economic disparities we have in our country. You know, in a world in which you open up certain parts of the country that have shown fewer outbreaks now, that's not a bad thing, assuming you have widespread testing and contact tracing. But that's not really going to marginally help the US economy, because the driver of the economy in the United States right now is still metropolitan areas.
Yeah,
and as long as those, right, as long as those are closed or not working at full speed, the US economy is still not working at full speed.
Yeah, I think it's something like, if I remember from my colleague Bruce Katz, 75% of the economy is in the top 100 metros. And that is the big driver forward. So we've got about 5 minutes left, and I'm just curious from each of you, what is the big thing you are watching and looking at? What do you think, particularly if we're between a V and a U? There are several questions in here. Are we going to tip into the next Great Depression? How long will this last? What are the things you are watching that will make the difference between a V and a U, particularly when it comes to employment? When or what will tell us and when will we know that employment is recovering quickly? And what is it that you're hoping will happen to accelerate that?
We should put tens of billions of dollars into testing and tracking, because that's the way we're going to help with both of these curves. That's the way we're going to reduce the health consequences and the employment consequences. And this is not just what pundits are saying, or not just what the science is saying, but also the economics, because there are many economists who are macroeconomists writing papers of this recession right now, and they're all emphasizing that we can save trillions of dollars worth in the economy if we have effective testing. And so we need the personnel, and we need the labs, and we need the equipment, and we need the science to put into that.
I will 100% echo what Leora just said. I mean, we in the United States are not particularly good at balancing short-term pain versus long-term gain. And this is one where it's not just public health experts, but it's economists who will say, the longer we can sort of shut down and help flatten the curve, the better we are in the US economy in the long run. Yes, there's going to be a short-term pain along the way, but fundamentally what you need in this country right now is confidence. You know, as I said, 2/3 to 70% of the US economy is driven by consumer spending. And if the American people don't feel comfortable going out in public, going to a ball game, buying a car, going to a restaurant, this economy just kind of continues to kind of chug along at a very low level. So it's a public health crisis first. And until you address the public health crisis, you can't really truly address the economic crisis.
Well, Leora and Chris, we are almost exactly at 12, just a minute or two to go. Let me start by thanking you both. It's been a terrific conversation. One, I think that we're all thinking about what's the thing that people once said, and Chris will correct me on the quote here. It's a recession when somebody you know has been unemployed. It's a depression when someone in your family has been unemployed or you've lost your job. And as we watch this, the human toll of the crisis is extraordinary. But I think the thing that's been gratifying to me at the Miller Center and beyond, including at UVA, is how many people are stepping up and doing every little bit to help. And I just want to thank you both for helping educate all of us on the big thing that we're all paying attention to. So thanks. And thanks to our whole team at the Miller Center that puts these things on, and to all of you that tune in. We do about 2 of these a week. I think we've got 2 more slotted for next week. You can go to millercenter.org to see our slate of events and activities. And we thank you all for joining, for sharing your questions, and also for your support over the years. So with that, we'll see you next week. Have a great weekend.